Hello, my name is Dr. Karen Scott. We believe at Medical Associates in the Department of Pediatrics that your child's health, safety, and welfare should take top priority. That is why we are working on following CDC and American Academy of Pediatric guidelines and recommendations during this time of the COVID-19 pandemic. Many questions have come up on what is the best for children and what do we need to watch for. Although it seems that we may have flattened the curve in the environment with relaxation of quarantine and strict social isolation guidelines, we still need to take precautions to help keep everyone as safe and healthy as possible. Children are still getting sick and need medical care for everything that we've already seen daily. Just because there's a new virus in town called COVID-19 doesn't mean that all the other illnesses we normally see, such as strep, pneumonia, urinary tract infections, and mono, have gone away. Children still need to be evaluated for these. If your child is sick, just call us for an appointment, and we will still evaluate your child and do the appropriate testing. Children also need to be seen for WellChild Care. The American Academy of Pediatric guidelines state and support continued WellChild Care visits during the pandemic are very important, especially if vaccines are needed. If you think you don't like COVID-19, then you're really not going to like the return of diphtheria, polio, or measles. Also, not coming in for your WellChild appointment will delay appropriate screening and referrals, as well as anticipatory guidance that will ensure optimal health. Depending on needs of this visit and the amount of acute COVID viruses in the community, some WellChild checks can be deferred or can be considered for telehealth, but only with timely in-person follow-up. Sports and adolescent exams still need to be done in person, but we do have some flexibility as to the timing of when these occur. The American Academy of Pediatrics is allowing every individual group to have some flexibility for individual areas, depending on the amount of COVID-19 in the environment, to how to best go about this. Here at Medical Associates, we were on the forefront of local clinics with establishing a safe screening procedure. Prior to your scheduled visit, call. You will be pre-screened with questions and it will be determined what is the best location for you to be evaluated. Upon arrival, we have screening pods where for everyone that is attending the appointment, there will be questions, there will be a temperature check, and you will be required to wear a mask. Once inside, we provide social distancing with spaced seating in the waiting rooms, rapid patient rooming, and once you are in a room, all these rooms have been thoroughly wiped down and cleaned in between every single visit. Every provider will also be masked and will glove for contact. If you have concerns about something that can be done through telehealth, we will also try to set you up for that option so you can have completely contactless health care. The good news is that most adolescents and children do very well with the illness, even if they are sick. Often the symptoms are very mild, but it may be similar symptoms, such as fever, cough, and shortness of breath. Children also can present with more atypical symptoms, such as GI symptoms like vomiting and abdominal pain. And even though overall many children will fare much better than their elderly adult counterparts, they can still get very sick, including infants under the age of 1. They can be hospitalized, and illness can even result in death. So it does need to be taken seriously. The main point to be aware of is if you are concerned that your child may have COVID-19 or may have been exposed to COVID-19, feel free to call us. We will evaluate your child and we will be able to test your child if it is indicated. Many people are also concerned about the reports now out of an illness called Pediatric Multisystem Inflammatory Syndrome, a potential association with COVID. It presents with symptoms very similar to toxic shock or Kawasaki's disease. These symptoms are prolonged fever, a diffuse rash, swollen lymph nodes, hypotension, potentially heart inflammation, and severe abdominal pain and vomiting. So remember, 1, if your child is sick, keep them away from other people. Have them evaluated if they need to be evaluated, but you do not want them to spread the disease to other people. 2, promote frequent hand washing. This virus really cannot handle 20 seconds of soap, nor can it handle hand sanitizer. To regularly wash your hands will decrease the exposure to yourself and to your family. 3, it's okay to wear masks, especially when you're in public settings such as stores or close contact situations with others. Regular masks still decrease the spread of secretions, which decrease the spread of COVID-19. And 4, continue to practice general social distancing. This is extremely hard, I know, for our adolescent population. However, even though an adolescent who gets COVID may do very well, the grandparent they take it home to or the parent they take it home to may not fare as well, and that needs to be taken seriously. Remember, Medical Associates in the Department of Pediatrics is here for you. If you have any questions, please call.